Hey, it's Dr. Kyle with All About Chiropractic. Today we're going to talk about neck pain. And if you're sitting there and the last time you drove in your car and you looked out your rearview mirror, you look behind your shoulder and you're unable to actually look all the way over your shoulder, we got a problem. Or you get up from your desk at work, you've worked all day long, sitting at a computer, pounding away at the old keyboard, and you notice at the base of your neck up and through here, you always have what I hear like trigger points, or it's always tight, or I have knots up in here. Usually that's an early indication that we got something going on structurally, because your neck muscles on the backside of your neck are responsible for holding your head up. And so, like if I was to use my 10-pound kettlebell, this is about roughly how heavy your head is. And so when you're sitting at your desk, or you're driving, or you're just standing, and your head's way too far forward, it's similar to if I hold this kettlebell close to my body, it's really light. But if I go and bring it out here, it exponentially gets heavier really, really fast. And so when your head's over your shoulders, where it's supposed to be, your head's truly going to weigh 10 to 15 pounds. But if I'm losing that posture and I'm pulling forward, okay, instead of having 10 or 15 pound head, it's going to be 20, 30, 40, even 50, 60 pounds. And what happens is we get pain up here. And the reason why is these muscles here are supposed to pull our head backwards. And so instead of being at a normal resting length, those things are going to be stretched out. They're going to be super tight, and we're going to develop problems. And so first thing that we do in our office is I want to look to see is, have we lost the structural integrity of our spine? You should have a C-shaped curve that measures 40 to 45 degrees in your neck. If we've lost that and that head's starting to pull forward and it's getting straight and straight, once we get to this point, it's degenerating. It's phase 1 degeneration, and if the problem continues, if you ignore it or choose not to address it, eventually we're going to have degeneration where we're going to have bone spurs, we're going to have arthritis, we're going to have discs that are drying up and deteriorating, when the structure of the spine is what's causing the issue, to have that neck curve where it's supposed to be. And so in the office, when you come in and you can't look behind your head or above your head, if you can't turn left and right, we know we have a neck problem. We know there's issues going on there. And so what we're going to do is we're going to take a picture. We want to take an x-ray. We want to see exactly what's going on there. Because I know if you have a loss of a curve in your neck, structurally, the curve, which is your spring, is gone. And so if we can get that spring to come back in your spine, it's going to keep those bones from deteriorating and causing degeneration in the bone spurs, which nobody wants, okay? And you know, the hard part about your neck spine is if you haven't had an x-ray taken, you don't know what it looks like. And you think about like your teeth. When you brush your teeth, you brush all of them, right? And the reason why is because you don't want one of them to fall out. And so you're going to brush them all to keep them clean. You see your teeth every day, so we have spinal hygiene or teeth hygiene. Well, when we look at the spine, if we've lost the curve, we need to get it back. And so when we take the x-ray, we'll take a look, we'll measure it, we'll see exactly what's going on there. We'll look to see if there's subluxations of the spine and that's what's causing the issue. And then ultimately, if the goal is to get a curve back into the spine so it can have its natural spring back in the spine, we're going to do a course of correction to make that happen. We're going to be adjusting the spine. We're going to be strengthening the muscles on the posterior side of the spine. We're going to be stretching ligaments on the front side of the spine. So that way we can get the curve to come back. And ultimately, if we can get that curve to come back, the pain's going to go away. You're going to be able to look over your shoulder when you're driving. You're going to be able to, have the full range of motion. You're going to get rid of the pain in your neck. You're going to be able to actually, spend time sitting at a computer and not, at the end of the day, feel like you just have knots up here at the top of your shoulders. Because ultimately, the muscles are going to be back where they're supposed to. Instead of being like this, they're going to be like this. And so we want to get the structure of the spine back where it's supposed to. And so we're going to do that through correction and treatment at the office. And so if you're dealing with those things, if you're having neck pain, if you're unable to look from left to right or look over your head, and if you're sitting there watching this video experimenting right now to see if you've lost that, go ahead and click the link below. Schedule an appointment. Let's set up the time for you and I to spend a half an hour, 45 minutes to go over what we need to ultimately get rid of the pain that you're having so you're not continuing to have to deal with that for the rest of your life. Or give the office a call at the number. Jen would love to schedule a phone call with you to get you scheduled to come in and see exactly what's going on so we can ultimately work to correct it for the long term, so that way you can get back the quality of life that you're currently missing.